Professor Ritz, colleagues, thank you for inviting me and to kick off the meeting. With one exception, it's going to be scientifically very interesting. Now, the topic to set the scene for you, well, let's see. A short history. Now, it could be said with some truth that the name of Parkinson could be nominated as the best known neurologist in the world. Because wherever you go, in whatever language, including Mandarin incidentally, it's called Parkinson's disease. So, to talk about this, and the irony that when he died, he was a nobody. He was unknown. His essay, issued once, never repeated, had a modest reception. He had some scientific achievement as a younger man, collecting fossils, but he was a nobody. While you're looking at his death certificate, look at the ages of those who died in Hoxton, revealing the quality of life. One child had yet to be baptized that died. So this was the world that James Parkinson lived. And as far as I'm able to tell you, there was no other record of his death. And the only interest was that they had to find someone to serve on the committee of the vestry because he was a devout man and took a very active part in the education of children in the borough of Hoxton. So much so that when his first biographer, Rowntree, who was a lecturer in pharmacology at St. John's Hopkins, he came across to England just before the First World War, and he delved. And we all owe so much to him, but he began his essay in that manner, unknown in every degree. So much so that even in his own country, right until the 1930s, it was never called Parkinson's disease, and the great Gowers, although he had a dislike for eponyms, rejected the notion. In France, the great Charcot, with some difficulty, obtained a copy of the essay and acknowledged it and gave eponymous distinction. A prophet is not without honor save in his own country. So there, after that, after the 30s, great interest began. And at the top, I put Dr. Rowntree's excellent essay. If any of you wish to delve, this is the one I would recommend to you. So, if so much is known about him and his disease and the history, how shall we go about it? And I've taken advice from a rather improbable source. And I'm going to invite you to consider what James Parkinson knew, what he didn't know that was known, and what's happened to his disease that he couldn't possibly have known about. And we'll go rather lightly over these because one mustn't be too serious at this time of the morning. James, in his essay, as you know, generously considered all that had been written, mainly in Latin, of course, and just look at some of them for a moment. Galen, who dominated European and Western medicine for 1,000 years, and then the group of the emerging nosologists, European mainly, who were just beginning to throw off the traditions of orthodoxy and assess the nature of disease, part of the scientific enlightenment, if you will. So there's the first chap, the great Galen, wrote in Greek, of course, translated by the Arabs, then into Latin, and now available to us now. I often wondered why Galen knew so much neurology, because he wrote it very extensively about it, until someone pointed out to me that he had a moonlight job as a physician to the School of Gladiators, and he must have seen a fair number of head injuries in his time. So here's the Latin bit. He describes tremor in different kinds and the causes. You see, he separates tremor of the ocular muscles, talks about it in agitation and depression. He knew his neurology very well. So that was the dominant orthodoxy. And then we come into the era of the European nosologists, Scorbius, Hieronymus Scorbius from Leiden. Here's an extract from one of his books. I've seen someone, vidie nemici currere non gradi poterat, I've seen someone who could run but couldn't walk. He'd seen it. He also mentions the same thing occurring with speech, festination of speech. And Juncker came from the same school. He was thinking about the nature of tremors, active and passive, related to paralysis, and James Parkinson acknowledged this contribution. And then the great Boissier de Sauvage. What a life these chaps had. There weren't many of them, but just look at his... First of all, he acknowledges Sydenham as the pioneer of clinical medicine. Then look where he'd been: Montpellier, London, Uppsala, Florence, Sweden. They moved around, these chaps, like present people going to congresses, I guess. But there were far fewer of them. But he was, too, a very shrewd observer. And James says, he separates here rheumatic chorea, of course, named after Sydenham, and he's beginning to evolve this concept of festination. De la Boer, great man too, from Amsterdam. There's his great work. And just if I may draw to your attention, in case there's anyone here from Holland, Elsevier still survives. And we always take the name with respect because Elsevier was the only publisher in Europe who published Galileo. Great courage. And they're still in business. I don't know who owns them, but it's a great name. So, de la Boer here, James puts it all together. Talks about Galen, Sylvius de la Boer, Juncker, Sauvage. And they were grappling, you see. They were seeing different sorts of tremor, some associated with paralysis. And James politely indicated that they really hadn't seen the wood from the trees. He had great respect, did James, for Cullen of Edinburgh. And again, writing in Latin, William Cullen addressed himself to this nosology, the celebrated Cullen, a custom accuracy. And he describes in the Latin the different sorts of tremor. And James politely said, yes, tremor is indeed a symptom, but they'd failed to see the whole picture. And there's the whole picture, as you know. Now, it would be impudent of me to remind you what a jewel of clinical observation it is, succinct and to the point and modest, critical. And if any of you haven't read it, you should be thoroughly ashamed of yourselves. It's a real beauty. And there's still jewels to be found there. There's some surgeons here, and they will remember that one of his observations, the one patient of 6 that he was able to take a detailed history, told James, this would never appear in a questionnaire, that before the tremor emerged, he'd had a stroke. Sorry, I've got that the wrong way around. He had a stroke soon after the tremor emerged. And while the paralysis was upon him, the tremor was in abeyance. And when the power came back, so did the tremor. That was the advent of surgical treatment. He also shrewdly, and I think probably erroneously, suggested that the disease began in the medulla, which is in accord with the BRUC, present classification. But that's not the end of it, because there is presently, they're devouring every word he wrote, and in that one patient, the patient that I mentioned to you, he also describes sleep disturbances and disturbances of the bowel. And to make it topical, William Langston's very interesting article stressing not only the duration of the disease in decades in all probability, but also the diversity of its manifestations. And you see disturbances that James had drawn attention to. This is important because it's altering our concepts, as other distinguished speakers will make, I'm sure. So we reached the point of what did James know. Now, what was there that he didn't know? Well, here's a description 40 years before his essay from Vienna. The Ariadne's threads for the students of the sea. He saw a man, or you can read it more quickly, and he had excessive secretions. But if that isn't sufficient, I'm indebted greatly to our president for drawing this to my attention, and for a colleague at Semmelweis who's translated it for me. This was written 130 years before the essay in Hungary. Most appropriate, of course. He wrote in Hungarian. Otherwise, you would write in Latin. And this was because the book, Peace of the Body, was designed for patients. And you have my word, I can't read Hungarian, but I have it on the greatest authority that these extracts are accurate. 130 years before 1817, when the essay appeared. Who else but the great Leonardo? Obsessed with movement all his life, whether it was movement of water or horses or facial muscles. And this page, I'm able to show you. You recognize the handwriting. The top bit is the movement of the bowels. The next bit is his observations on penile erection. There were all sorts of phony explanations, and he said it's obvious. If you feel the penis, it's red and hot, so therefore it must be due to blood. And he was right, of course. But at the bottom, he talks about voluntary control of movement, really. How nerves sometimes operate by themselves without any command from the soul, will, voluntary, conscious. And he'd seen it in paralytics, he'd seen the effects and so forth. So Leonardo had almost certainly seen static tremor. Now, the further you go back, the more difficult it is, because observation's always mixed up with religion, shamanism, philosophy, adulation of the royalty, and so forth. And there's the reconstructed Abu Simbel. And I once asked Professor Smith, who at that time was Professor of Egyptology at UC, could he find a papyrus that might suggest it? And that's what he came up for. I don't know, we shall never know, whether that old king had Parkinson's disease or not. Now, we must give credit to the Indian culture. Many years ago, I had the opportunity of going to Varanasi, Benares, where there's the Holy River, and down the banks of the river is a Hindu university with all the Sanskrit incunabula. Ayurvedic medicine. They had a condition, Kamparata, a shaking palsy, and colleagues, look at the drugs that were used in Ayurvedic medicine. 3 solanaceous alkaloids and 1 mucuna pruriens containing levodopa. And when the levodopa story broke, this was dispensed because the amount of money that was available in the village for treatment of Parkinson's disease, but the extract of the plant was widely prescribed. Remarkable. There it is. So what of the longest continuous civilization? Very difficult. I once had the privilege of being with Professor Wang Xinde, who at that time was lead of the team treating Chairman Mao's Parkinson's disease. And with beautiful English, most wonderful English, taught English by the missionaries in Shanghai. And I said to him, now look at all your firsts. You know them, silk, everything, circulation. And I said to him, surely your Mandarinate had produced doctors who could recognize Parkinson's disease, if it indeed occurred. Oh, yes, he said, yes. So I asked him to write the character in Mandarin. And I was very chuffed, as you can imagine. And I said to him, Professor Wang Xinde, I'm delighted. How do you pronounce this in Mandarin? And he looked at me rather coldly and he said, in Mandarin, we call this Parkinson's disease. Absolutely true. So I then asked him for some references, and he couldn't think of them offhand, and he died a couple of years ago. So I felt incumbent upon you to do a little research. And recently I've had the great privilege of talking with Professor Moffat at the Needham Institute in Cambridge and Professor Nathan Sivin in Philadelphia, who has the largest collection of original, early writings. He's told me he still has 40,000 documents to read. And here's a collection that I've got so far, written during the Ming period, describing tremors of different kind, with and without paralysis. But the difficulty is the conflict with traditional Chinese philosophy, because nowhere is the brain mentioned, and it's all attributed to disturbance of yin and yang and qi and vapors coming from the spleen and so forth. They're burrowing away, and maybe something more definitive will emerge. All right, that's the history. Now look at it from James Parkinson's point of view. He writes us a letter from neurological nirvana and says, all right, I'm a practical man. What's happened to my disease? What have you done? What treatments? What's the cause? And we'd have to refer him to history. There's a little bit he'd forgotten. And this was my mission when I went to Varanasi. This is Rauwolfia serpentina. Rauwolf never saw the plant, serpiginous root, but it contained, what did it contain? Exactly. And this was the first instance of drug-induced Parkinsonism. The story is really very interesting because Nathan Klein was a serviceman in India. He heard about this plant, Chandra, it means moon, because the Indian Ayurvedic doctors recognized intermittent lunacy as be relating to the moon. So they gave this plant, or extract of the plant. And he brought it back, he gave it to chronic schizophrenia, the first neuroleptic drug. All that was available was phenobarbital and chloral, with very good results. And a year later reported, rather casually, that 3 of the 100 patients first given the drug developed Parkinson's disease, drug-induced. Now, I'm that old, I can tell you of the struggle, the great struggle that Carlson had to convince pharmacologists, people like Gadam and so forth, that dopamine really was a neurotransmitter. There was a famous meeting in London in 1960, and he was laughed out of court. And he remembers this bitterly. But it was because he gave reserpine, and the effects of the reserpine on the rabbits really entered the era of levodopa. I've never had the courage to ask Arvid, supposing reserpine had not been present, would you have got the Nobel Prize? But he got it. History. This lady took a dominant role in the evolution of the doper story. Maria Theresa was a very strange lady, highly promiscuous, a very good politician, and she passed a law which has never been revoked, that in the cities of Graz and Vienna, Vienna inside the ring, anyone who died should have their brain preserved. So, when Ole Hornikewicz came to England, to Oxford, and worked with Blaschko, Blaschko said, this is in Ole's anecdotes of his biography, he said, I think dopamine's got a future, stick to it, Ole. So Ole went back to Vienna, where they had this enormous collection of brains. And he was told by the boss, Professor Brücke, just use this technique you learned to fluorescein tag dopamine. You see the patients, you don't have to read German for this, but a variety of disorders. And among the controls were 4 patients with Parkinson's disease. So he was the first to discover focal deficiency of dopamine in Parkinson's disease. There was a most amusing, acrimonious debate between Ole Hornikewicz and Birkmeyer, who never spoke to one another again, of the famous doper effect, giving intravenous amino acid and the waking up effect. Now the rest is history, but this curious conflation of Maria Theresa, going back to Vienna, coming to Blaschko, all the rest of it, is one of the great stories of science. Now the final phase of the history, I hope, and John's taking very careful note at the back, February 1953. Now, you all know the story, but it's worthwhile repeating. Outside the Cavendish laboratories, 2 fellows staggered across the road, entered the Eagle pub, and announced to the rather startled spectators who were concentrating on their beer and the progress of their football team, the taller one said, "We have just discovered the secret of life." Apparently no one took any notice. James went back to put up that plaque, which you can see outside the pub now. And these were the 2 geniuses who cracked the double helix. You remember, they did no research. Crick had not yet completed his thesis. I understand he got the thesis just before he got the Nobel Prize, but in that sequence. And they wrote that shattering letter with probably the finest throwaway line in neuroscience. It has not escaped our notice that the specific pairing we have postulated suggests a copying mechanism for the genetic code. I would like to think that this is the final part of the history of Parkinson's disease. Now, when an etiolated, worn-out clinician talks to an audience on molecular biology, this is the appropriate stance to assume. They're all asleep. One of my favorite slides, this. There was a lot of physical signs to be seen in neurology. Head nystagmus was the commonest one. There's only one person half awake, and he was watching the girl going round with a microphone. She was more attractive. But those who were asleep, all sorts of aberrations of respiration were recorded, including one man who kept saying, "Mother, mother." So you may all relapse into this state, because this was the messianic message. This is what we'd all been waiting for. Unprecedented opportunities. At last we were going to solve the 3 S's in which we compounded our various theories: seed, soil, and time. And then there was the explosion, which, perplexed clinicians like me find it very difficult to follow. There's some of the headlines. That's the letter, by the way, was to Nature, not the Lancet. The race for the first draft of the human genome, the speeding up of breaking down the code, the enormous amounts of money that have been fed into it, and how the genome large-scale projects, and I'm not provoking John particularly at the back, because I'm sure he'll respond very adequately to my challenge. It didn't give us the answers. It was far too complicated, so we had to introduce epigenetics, those changes to gene expression caused by other factors, making the order of magnitude in understanding molecular biology and disease and the neurodegenerations in particular much, much more difficult. So we had to call in the four horsemen of the apocalypse: genomics, epigenomics, proteomics, and metabolics. We haven't finished. Nutrigenomics is the most recent one. All of them trying to crack the code of what happens between the genome and the disease. And there are some doubters appearing, from unprecedented opportunities for science and medicine to more skeptical remarks. Little value is likely to emerge. Gigabytes of undigested facts. And my dear friend and colleague, Professor Steve Jones, Professor of Medical Genetics, who writes so beautifully and so wittily about genetics, it was he who coined the phrase molecular biology is nothing more than anatomy, very small, but with a very large research ground. And he has written about the cavity of the cat. It's never there when you expect to find it. Le Fanu has also written very well about this. And this is the most recent assessment I put before you. February. Distinguished molecular biologists, more cautious, less messianic. The road ahead, continuing upward trajectory of sequencing technology towards an era of genomic medicine, and bottom line, the budgets required invite a visceral reaction, enormously expensive. So here is a statement from a very shrewd and experienced molecular biologist. My own view, and my opinion is of no value, that this is defeatism. I don't think that that's there. But for an aged clinician, what is clear to me is somehow we've got to do a Kuhnian paradigm shift in what constitutes a disease. And the old one of history, symptoms and signs, pathology, dull, short section on treatment is quite inadequate. We've got, and people present here I hope will facilitate this, we've got to get an understanding of how a disease occurs, like Parkinson's disease. Why is it only 1 or 2% get it and 98, 99% do not? How is it triggered? What determines the clinical pattern? Why do some people run a malignant course? Why others run a gentle course? All this will have to be exposed and understood. So let's return to James for his advice. He apologized in his elegant manner for publishing his essay. We will repine at no censure. He wouldn't mind if he was criticized for publishing the essay, but shall think himself fully rewarded by having excited the attention, that is yourselves, who may point out the most appropriate means of relieving of what is still, I'm afraid, a very tedious and most distressing malady. Thank you for your attention.